We're doing a special broadcast from Independence Blue Cross with Secretary Val Arkoosh, and she's the Secretary of the Department of Human Services. We are also joined by Lorina Marshall Blake, who is the President of the Independence Blue Cross Foundation, and Koleen Cavanaugh, who is the Chief Marketing Officer for Independence Blue Cross. Thank you all for joining us.
Thank you, Sarah. Thank you, Sarah.
Absolutely. This is a real treat. It's a real opportunity. You are newly confirmed as the Secretary of the Department of Human Services. So, Secretary Arkoosh, can you please tell us what exactly is encapsulated under this Department of Human Services?
Well, thanks, Sarah. It's great to be here with you. So the Pennsylvania Department of Human Services is the largest state agency, and we oversee the Medicaid program, which is also known as Medical Assistance Program here in Pennsylvania. We oversee mental health services, child welfare in the juvenile justice system. We assist people with developmental disabilities. We also help support our child care system in the Commonwealth, along with early intervention and early learning programs. And then also under DHS is something called the Office of Income Maintenance, and they work with people who are signing up for the Medicaid program or other really critical benefits like SNAP, the Food Assistance Program, TANF, which is a income maintenance program for low-income individuals, LIHEAP, which helps people pay their heating bill, things like that, programs like that. So we have a really broad mandate.
So, before you came into this role, you've done many things. I know you were a commissioner in Montgomery County, but you're also a physician. Yeah. And so I want to talk to you a little bit about the social determinants of health. And that's a relatively new construct, I think. Racial health disparities are kind of the way that I look at this, but things like poverty and transportation, housing, racism, job opportunities, all of those things conspire to keep certain people unhealthy. And it's not just about exercise and diet and nutrition. It's really about this holistic approach. They all have a direct impact on your health and your lifespan. And so I want to know, what are you going to be able to do as a physician in this very critical role in the Department of Human Services, leading the Department of Human Services for the Commonwealth? What are you going to be able to do to address racial health disparities, to create more equity among Pennsylvania residents and Philadelphia residents?
Yeah. Well, I'm so glad you asked me that question. This is really the issue that brought me from practicing medicine to where I sit now. I practiced medicine for 20 years in Philadelphia teaching hospitals, and I'm an anesthesiologist. I specialized in obstetrics. And one day I was on the labor floor and I was talking to a woman who was about 8 months pregnant. She'd just been diagnosed with diabetes, and she had to be hospitalized because her diabetes was very serious. And I was talking to her about her diet, and she just looked at me and she said, "Doc, I've got 2 other small children, and I have to take 2 buses to get to a regular grocery store. The only thing I can walk to is a corner store, and they have no fresh fruit and no fresh vegetables." And she said, "I don't know how I'm going to do this." And I, as someone who was always able to get to a grocery store, it was such a wake-up call for me and really began my journey to think about health a little bit differently. I couldn't write a prescription to put a grocery store in that mom's neighborhood, but that's what she needed more than anything. And so I actually ended up going back to school to study public health and have taken a very different path to now be leading this state agency where I have many of the levers at my disposal to really start to address this problem. One of the things I'm particularly happy about is that in the Medicaid program, we now have the opportunity to create the mechanism to use funds from the federal government to help pay for things like getting access to healthy food, almost like a food is medicine concept. We have the opportunity to get dollars to help with housing, to help with reentry, and to help very specifically with maternal health. Because I think if you look here across our Commonwealth, but particularly here in the Southeast, maternal mortality is just unacceptably high, and it's been decreasing despite lots of, well-intentioned efforts. We haven't even plateaued. It continues to go up.
Especially in the Black community.
And it is 3 times higher in Black birthing people than it is white people.
Yeah.
And so this is just a crisis as far as I'm concerned. It's an unacceptable crisis. And so we are looking at many things that we could do to be much more holistic in how we approach this work. We have created a mechanism where doulas can become Medicaid providers. Doulas have been shown to be extremely helpful to pregnant people, both antepartum, during labor, and postpartum. We want to make sure that doulas can get paid to do that work. And we're working on a number of other initiatives that we're still putting together around food, housing, and a much more holistic view of this work.
I'm really happy to hear that because what my experience with the healthcare system, and I have great health insurance and all of those things, is that it's very fragmented. Our system is incredibly fragmented, and it's, there is not a holistic approach. And so if you are under-resourced, if you are low income, you have small children, multiple jobs, it's almost impossible to navigate the health system, and especially if you have a health challenge. And so I'm hopeful that based on what you just shared and use that word holistic, that you in that role are going to be able to knit things together to make our system much more navigable and accessible for everyone, whether they have commercial insurance or Medicaid or whatever. So it's a big charge.
It's a big charge, and I'm going to do everything important. I can in that direction.
So let me turn to you, Lorina Marshall Blake. You are the president of the Independence Blue Cross Foundation, and you are the convener, I believe, of today's gathering to really talk about Medicaid. But I know, because you've been an advocate, you've been such a stalwart in the city of Philadelphia around health advocacy and access for years. And I know that creating more equity in health and wellness is very important to you. Talk to us about today's convening and the Independence Foundation's role in creating more access.
Sure. And look, we're so proud to be here, to have the opportunity to be with the Secretary and also to be with you. Again, every year we gather. This is not something just happened today. It's something we do every year where we get together with our health centers, and we have over 70 of them, that we come together and we don't dictate to them. We listen to hear what they have to say. We update them about our partnerships, what we're doing. They update them about what they're doing. And the key to this, again, and you've said it, health equity. The foundation has been doing health equity before it became a buzzword. We've been in existence since 2011, and since then we have been spot on. That's where we've headed. And again, the meeting today with Secretary Arkoosh came to talk about again the Medicaid redetermination, and we thought what a great opportunity to bring together the health centers to have a conversation with her. Can we talk? And I believe they were very direct today, and they asked questions that needed answering. And again, it's not a one and done, because what she also did was extend to them the opportunity to continue to reach out to her office. So it was a great opportunity to do ourselves. And I think you said it. The foundation has been the one to be the convener, the thought leader. And again, sometimes we have uncomfortable conversations, but somebody's got to be the elephant in the room. What are we going to do with this? But again, the foundation's been committed to improve access to care in underserved communities for more than a decade. And funding, again, these various health centers throughout Montgomery, Bucks, Delaware, Chester, and Philadelphia. So it's region-wide. And by the end of this year, we will have given out over $80 million in charitable grants and supporting research to enable regional nonprofits to provide care. So it's not just Philly, it's throughout the region. Again, the focus, access to care, building the healthcare workforce, nursing's our sweet spot, and then health equity. And what we've done today, I think, is just talk about the vital role of health centers. They're right. I always tease myself and say, I'm a street woman. They're right there in the community. So, and many people won't go to the hospital, but they will go to the health center where they're treated with dignity. They are embraced. They are even empowered. And it's not always just health. It's one and done. They may go there for LIHEAP. They may go there for PICO, PGW, and everything else. So again, we're a part of that. Again, I want to mention that last March, we instituted the Healthcare Institute, which what the Institute does now, it does research, and then the research then informs where the foundation will go. So it's not one of those things, again, this is what we will do. Okay, it's what is we're all about community. If I had to pick a word, community, community, community. So it's always all about the community. And again, there's another initiative that we're doing with our health centers that I want to mention, where it's a new accreditation, NCQA, for health centers. And that just gives them one more credential that affirms and confirms the great work that they're doing. So we've reached out to do that. We have about 5 health centers that are doing that. So again, we're always looking to, I often say, we are more than a check. Okay, and I always say, we don't want to date you, we want a marriage. So we want to work with them. So we want to work with them.
That's unique these days and times.
No, but again, we're not getting their business, but how do we help them to be, the key word here is sustainable and to be innovative.
Yeah, so, and Koleen, I'm going to come to you in just a minute, but I want to come back to you, Secretary Arkoosh. Because I know that the Medicaid redetermination process, which is a big part of what we're talking about and what you convened the health centers to deal with, was spurred because during COVID, there was kind of a pausing of this like annual renewal process. And so, COVID was such a dramatic, I don't know how to call it, black eye, bludgeon, whatever you want to call it, for everyone, especially the health system. And I want to find out from you, Secretary, like what are some of the lasting impacts of COVID-19 and how are you in your role navigating that? Because, and we'll talk about the Medicaid redetermination in just a minute because that is an outgrowth of the COVID-19 pandemic. Talk to us.
So, COVID is going to have a lot of lasting impacts, and I'm not even sure we fully understand them all at this point. Our health care system really hasn't entirely recovered. Things are getting a little bit better in our hospitals. I've talked to a number of hospitals recently that said that they're finally getting some of their workforce back, or they're stabilizing their workforce so they're able to use less of that contracted travel workers. So that's good news. But I think that the impacts are way beyond that. And some of them are good. We figured out as a country we could develop a life-saving, incredibly safe vaccine in an unprecedented short amount of time. We figured out that hybrid work can be pretty nice for a lot of people, and it's created a lot of flexibility for families and others. But the experience of COVID really just put into such stark reality the role of our frontline workers in our communities and the fact that those workers were mostly people of color and how they had to go to work every day to really keep everything else going. And they bore a huge price because of that in terms of illness and sadly in lives lost. And so I think that as we start to emerge, we really have to be mindful of who was the most impacted during COVID and start to tailor and continue, which is in many cases, continue to tailor this recovery around the people that were most severely affected.
I like that. I appreciate that. And so I'm going to come to you. Koleen Cavanaugh is the Chief Marketing Officer here at Independence Blue Cross. And so you are kind of on the front lines of helping consumers navigate this Medicaid redetermination, re-enrollment. And I'm assuming that because there was this gap of time, there was this amount of time where people didn't have to go through this annual renewal process to be eligible for Medicaid and other things, I guess CHIP, which is the Children's Health Insurance Plan, and some of these other government services, people didn't have to go through the process that they have to re-engage with now. So talk to us about Medicaid redetermination. What if I'm a Medicaid recipient, what do I have to do? yeah.
So thanks, Sarah. This is a big thing in health insurance. I think it's one of the biggest things since the ACA came about, back in 2013,
Affordable Care Act.
2014. Yes, the Affordable Care Act. So there are millions of Pennsylvanians as well as millions of Americans that are going through this process now. So during the pandemic, they did not have to do an annual redetermination, verify their income and their eligibility for Medicaid. They were able to stay with their Medicaid coverage. But as of this year—
Can I just ask you, what is the eligibility requirement for Medicaid?
I will pass that to the secretary for that.
So it depends on the size of your family. And I don't think I have those exact numbers right in front of me.
That's
I'm
okay.
sorry. But it varies with size of family.
Okay.
Yeah.
Okay.
So and it could be health reasons as well as to somebody qualifies. So it is a little bit more complex as far as the eligibility requirements, but that's why it also is important to redetermine that eligibility on an annual basis. But through the pandemic, to ensure that people had coverage, that was vitally important, that people have their health insurance through the pandemic. That redetermination process, though, while states were asking for the information, they weren't dropping anyone from coverage, right? So some people have been providing that information, others have not. I mean, it is difficult to reach everyone. So one of the critical things as we go through this redetermination is to make sure that people actually are providing their updated contact information to the department, to make sure that we can reach them, or the department can reach them, I should say, through their address or through email or through texting. They're leveraging every channel in order to reach consumers to make sure they understand what they need to do, why they need to do it, and when they need to do it by, to ensure that they stay covered. For those that are no longer eligible for coverage, that's where independence really comes into play, because we want to make sure that those consumers who are no longer eligible for Medicaid get a consumer plan, and really the best place for them to shop is through Penny. So Penny is our state-based health insurance exchange. For those that are listening, it's pennie.com. So they should go to Penny and really look and see what they're eligible for, because there is financial help through Penny to also help people afford health insurance as well. Those who are in lower incomes may not only get help paying for their monthly insurance, but also get help in paying for the cost when they actually need to receive care. They can get reduced cost sharing when they need to receive doctor's appointments, hospitalizations, things like that.
We are talking about Medicaid redetermination. We're talking about health disparities, the social determinants of health, health equity, health access. That was Koleen Cavanaugh. She's the Chief Marketing Officer for Independence Blue Cross. But we are also joined by Lorina Marshall Blake, President of the Independence Blue Cross Foundation, and the newly confirmed Secretary of the Department of Human Services, Secretary Val Arkoosh. And so I want to ask you, Secretary Arkoosh, about this. We live, I would say, in kind of a caste system when it comes to, well, we live in a racial caste system for sure, but we also live in a caste system around health insurance. Mm-hmm. And what I know is that there are places that don't accept Medicaid, or they don't want Medicaid patients because the reimbursement is lower or whatever. And so this caste system is like commercial insurance, and there's like tiers there. And a lot of times people who are low income, which are oftentimes the Medicaid population, they are dealing with a lot of barriers and a lot of challenges. And so I want to know from where you sit at the top of the food chain, what are you going to be able to do around for Medicaid eligible, for CHIP, for all of these people who are vulnerable, to create a more equitable system that allows them to get the highest quality? Because it's just like public education. A lot of times the most in need students get the worst resources. They get the worst facilities, et cetera. It's the same. The most vulnerable health-wise oftentimes get the worst health insurance. Not that Medicaid's the worst, but a lot of people don't accept it. and there are barriers. So what can you do as the secretary to make sure that the system is fairer and more equitable and more accessible?
Yeah, it's definitely something that we think a lot about, Sarah. The Medicaid system is a system that is half federal, half state. So in other words, little over half the funding comes from the federal government, and then the rest of the funding for the program comes from the state. And so we do have to follow a number of federal rules in the program. And so sometimes that can be, a little bit of a constraint. One of the things that we're very mindful of is that just because, as you said, just because you have insurance doesn't mean you have access. And so we do have requirements in all of our Medicaid plans that they have to have a certain number of providers in certain areas so that people can have access. And I'm also happy to say that all of our teaching hospitals, which in the Commonwealth are really our finest, highest quality institutions, every teaching hospital in Pennsylvania is an active participant in the Medicaid program, and they will always take patients who receive Medicaid. So that is a very important thing for people to know. I think sometimes people are intimidated to go to a place like that, but they will always be able to be seen in one of our teaching hospitals.
That's good to know. I didn't know that.
Yeah.
Do the teaching hospitals know that?
Absolutely. Yeah. Absolutely, they do.
Okay.
Yeah.
All right. Great. So I'm going to come back to you, Koleen. Like, if somebody needs to figure out their eligibility or, like what that process is to re-enroll, where do they go? How can they find more information to make sure that they're on top of this? Because, everyone needs to have, we are human, we get sick, we need to have access to quality care no matter what your circumstances are. So where do people go?
So if they're currently Medicaid eligible today and they're going through the redetermination process, we really suggest that people reach out to their local county assistance office. I think that's an important resource for them, or they can call the state, which is 1-800-866-550-4355, and there will be agents that can help them, talk them through the process, help them understand what they need to provide, how they provide that information, and talk them through everything that they need to do to ensure that they stay covered. And again, if they do not qualify any longer for Medicaid, it is important that they get insurance through ideally Penny. They may be eligible through their employer. Everybody is in a different situation, but if they don't have employer insurance, then Penny is available. And again, that's PENNIE.com, where they can look and see all of the options that are available to them. Independence, we believe, obviously, is a great option for people as far as getting coverage. We are the largest carrier in the Philadelphia area for health insurance for those that are purchasing through Penny. And our network, to your point around network, we do have the strongest network and the largest number of providers here in the Philadelphia area that are eligible with our insurance.
Yes. Can I just add to that just a little bit? So anyone who is due to be renewed or to go through this process is going to start to hear from the Pennsylvania Department of Human Services about 90 days out from the month that they're due. And they'll get.
How are they going to hear from you?
So the first thing they're going to get is a packet in the mail. But if we have an email or a cell phone, we'll be texting them and emailing them as well to remind them that their time is coming. And they can, in addition to walking into a county assistance office or calling one of our call centers, they can also go online to the Compass webpage, and then there's a free My Compass app that people can download on their phone, and they can do the whole thing through their phone if they have a smartphone, including uploading documents. So we've got a lot of ways that people can access this information.
I just want to, I'm always mindful of barriers. And, it used to be called the digital divide. Now it's called something else. I forget what it's called now. But I do think that digital access piece is another barrier. And I think most people have smartphones and so that's wonderful. But there are a lot of older people who have a lot of challenges navigating the technology piece. And so I know that you gave an 800 number, which is great, but I want to know what are the kind of old school ways that people can access this information outside of like the digital space.
Yeah. So literally they're going to get paper in the mail. So that's a starting place. And then they can walk into one of our county assistance offices. Every county in the Commonwealth has at least one. Philadelphia, I think, has 3 or 4 county assistance offices, and sit down with somebody and get help. And we also have language line available. So if someone is more comfortable in a language other than English, we have ways to accommodate that. And then this is where we need our partners. And this is what was so great about the room full of people that Lorina pulled together today, because they were federally qualified health centers and other community-based organizations that are our boots on the ground. Like, this is an all-hands-on-deck project here in the Commonwealth, and we need every partner on the ground helping us to do this work.
So, we're a talk radio station.
I do.
So
No.
I want you, Secretary, to commit to coming back in like 6 months. And we can open the phone lines and see what the lived experience is for people who are trying to do this. Because I do think that it's great, like it sounds, but I know, like, again, somebody who has decent resources, how, like, you can get really
And I hope I can come back quicker than 6 months, because I want to do it sooner than that, so we can make changes in real time that'll be impactful.
As a matter of fact, in the convening today, there was a conversation with one young lady with regard to her experience with her parents and filling out the paperwork. And she complimented the secretary on Compass, on the system, and how it worked. But still, she also said, but there's some things that could be enhanced. So again, the secretary was more than willing to, okay, let's see where we go from there. And that's why I was excited about today. It was an open conversation, no holds barred. Let's put it on the table. Let's see what we can do. And I think, again, these public-private partnerships of coming together are so important when I look at what we're able to do at the foundation and do with all of our partners that we work with. So, again, I think we're here to help and do what we can. And I think the key has been today was really listening. But I said to the secretary, don't tell me you care, show me you care. And I think that's what she's done. Absolutely. So, and is willing to do. So again, this is just a great opportunity to get the story out and now hear this. So here we go from here. So.
Absolutely. Excellent. So we're just about out of time. I just want to reintroduce everyone. That was Lorina Marshall Blake. She's the president of the Independence Blue Cross Foundation. We're also speaking with Koleen Cavanaugh, Chief Marketing Officer for Independence Blue Cross, and the Secretary of the Department of Human Services, Val Arkoosh. And I have one final question for you, Doctor. I'm going to call you Dr. Arkoosh. What does success look like in your role? And what would you like to see? Like, what metric would you like to see changed at the end of your tenure? I don't know whether that's 4 years or 8 years or whatever, the end of your tenure in this role. What do you want to move most notably?
Yeah. I would like to see some of the things that we talked about at the very beginning of this conversation today improve. I would like to see maternal mortality rates actually going down, particularly in communities of color. I would like to see the rates of people who are experiencing homelessness or living unsheltered going down. I would like to see less difference between health measures in Black communities and other communities. We have enormous disparities in health across our communities. So I am working every day to help support and help build as we can healthy communities. That's where we have to focus. And if we can get that holistic approach put into place, it's just about how we do business, I'm really hoping that we'll be able to achieve some of those goals.
Thank you so much. Thank you to Lorina Marshall Blake, to Koleen Cavanaugh, and of course to the Secretary of the Department of Human Services, Val Arkoosh.
Thanks, Sarah. It's great to be here.
Thank you. Thanks so much.
Thank you.